Reaching vulnerable populations has been a challenge for us in Belize, along with many other countries, not only with regards to the vulnerability due to gender, due to age, due to other factors.
If we are to ensure that people have access to adequate health care, we must improve our primary support, and which is the rural communities.
In regards to the community, the group that has been on the forefront is what we call the community health workers.
I was in Corazon when I received a message that they want each villages to have a health worker. The alcalde held a meeting about choosing the health worker to work amongst the community. They chose me to be a health worker, so I make up my mind to work as a community health worker, to take care of my people.
You're talking about a network of over 200 community health workers, also including over 100 malaria voluntary collaborators, some which have dual roles. They're both VCs and CHWs.
We have barriers and constrictions when it comes to access by roads, by foot to certain areas. We have language barriers as well.
Lain nakil na kau chok rehep kakalebal na ako na angel sa inka maarukin at kamaeba health worker mag sa in kikil chikamaan pas sing pusla na ting ekip sa uting timbanok angel lain hok trip ale bakakalebal sa inse halate.
People would go to them for fever, so one of the functions was, you have fever, let me investigate. If it's malaria, I treat you.
So the people rely on us. The first people that they will run through is to me, to seek help from me. I take the blood sample on the smear and then we send it to the lab in PG with malaria, and then we waited for the result. When the result came in, if that was malaria, and then the people from vector control will come and do the treatment for the person.
These voluntary collaborators were always in training. They had a continual support from the headquarters and also a day-to-day support from the district personnel. The supervisors would visit them to ensure they have supplies, they have the lancets to pick up slides and then take back results to them. So they were key because they were at the village level every day.
Estoy trabajando como promotora de salud. Tengo 13 años de trabajar en eso. Yo diría 24/7 porque en mi caso, yo vivo acá en mi aldea, entonces todo el mundo sabe, me conoce a dónde vivo y a quién acudir a la hora de tener un síntoma, porque trabajo como colaboradora de malaria y también como community health workers.
But at the same time, more functions were given to them. Not only malaria, but other functions. It started off with HIV, with cholera, tuberculosis, etc. Other diseases that need that day-to-day surveillance and care at the village level, at the local level.
And these community health workers were chosen by the community members, and they come into the main areas, they get training in healthcare, training in management of certain illnesses, and they provide, they're called our ears and eyes in the community that's most vulnerable.